Let's take a look.
Can't believe it. That's insane. I'm so glad I came.
Hello everybody, I'm Dr. Sue, and I'm here with Samantha today. How you doing, Samantha?
I'm good, yeah,
Okay.
excited.
Excited, and we're excited because we're going to do some lipedema liposuction today. Lipedema liposuction includes the entire legs. It can include the arms, but today we're just going to do part of it because we can't do all of the entire leg 360 degrees. We can't do all of that in one day, so we got it broken up, and we're going to do what we call the CANKLEs, which is ankles to calf, as well as the knee complex, which is calf all the way up to about mid-thigh. So that's what we're going to do today, and that's why we're excited. So Samantha, do you mind telling everybody, about your story and what you've experienced, going through?
So in my past, I've been a gym instructor, owned my own female gym. Very tiny, very slim-toned arms, but I always had these bigger legs that I covered up. But it wasn't such an issue because I hadn't had this weight gain. Now I've had some weight gain after my children. That's when I noticed I was having issues with my walking gait, the pain in my legs. My children couldn't climb on my legs, I could feel the pain. And I noticed on other people, they would climb on them and there was no pain. And I did start thinking, there's something different here. Mm-hmm. But I still didn't know about lipedema at all until I started really thinking I wanted liposuction because I couldn't lose the weight myself. I was doing 2 workouts a day, I was fasting, and my upper body was losing some weight. My waistline, I've lost like 2 inches, but my thighs, my legs, the inches weren't going down. And then I did happen to come across your videos on YouTube when I was just looking at what people could potentially do for the legs in liposuction because I was still trying to talk myself through more exercise, more diet. And then when I started seeing the women with the same shaped legs as me and the same stories, I realized maybe I had this condition. So I went to see a specialist and immediately they said, yes, this is what you have, this is what you can do, you can have compression, you can do all of this. So then I circled back around to you because I was like, this is the best way at the moment that they know to not cure it, but relieve you of the problems and also your own self-esteem, because I wasn't going to be happy living like this, covering myself up like I have been. I want to be able to wear shorts. I've got 2 young girls and I want them to see a mum that's confident out there in the sunshine. I live in Texas, Houston, it's hot, and I'm in jeans. And I don't want to be in jeans.
And for those of you watching out there that may just be learning about lipedema, it's fat that by its definition doesn't respond to diet and exercise. It's a different kind of fat. It's metabolically different. It's also diseased in a way that it causes pain and tenderness, right? Is that what you experience?
I do get pain.
Which is not something that you expect of normal fat. So by doing liposuction, we can actually do something about this disorder. If you don't have liposuction and you want to treat lipedema non-surgically, you really are kind of left with compression garments which don't get rid of the fat. They kind of help support things where it reduces the symptoms to some degree, helps reduce the amount of swelling that some patients get as the disease progresses into later stages. But it's more palliative type of things. It doesn't really get to the issue. So
we're stuck in them.
Yes, and as we talked about, it doesn't go away. You can do all the dieting, exercise, and these areas don't get better. In fact, oftentimes they get worse with time, with changes in in hormonal states as pregnancy, menopause, and things like that. Patients oftentimes see major worsening of the condition.
Yeah, I used to be able to lose weight, but I still have the same shaped legs. Never had knees or ankles, and I look at other girls at school. So it started off when I was a teenager, and I saw they had the little Achilles heels, and they had the little, you can see the little motion in the knees. I didn't have that, even though I was 110 pounds, 120 pounds.
So this does happen to, and it's a disorder that small, petite, females get. 110, 120, 130 pounds. You think, oh, no problems with fat, but all it takes is about 3 to 5 pounds of fat on the legs for it to accumulate around the ankles and knees, and for it to take away the nice slim tone look, as well as, you know, just make it look unsightly. You are a personal trainer by trade, right? Mm-hmm. Did you do boot camps? Did boot camps,
cardio workouts.
Okay.
Yeah.
Have you ever been in a boot camp?
Yes.
Okay. I'm the boot camp instructor today. This is my boot camp trainee, because the way that we do things here, I do things a lot differently than most doctors. I came up with my own technique years ago where I have patients tighten up their muscles. So if it's the arms, we'd be tensing like this. If it's the leg, I'll have them tense up their leg, because it adds to the control of the liposuction. That's why I can do things very smoothly, accurately, completely. All these things are not natural to liposuction. They're very difficult to achieve all those things, and that's why we're going to have Samantha doing the boot camp today. And hey, you mind if the audience comes in and takes a peek while we're doing the surgery?
Yeah, absolutely fine. Come on in
so
and see.
We'll show you what it looks like during parts of the surgery, okay? And we'll show you the results, because when we're doing a weight, we can check our accuracy in front of this mirror right here, and we can see exactly what everything looks like when we're done. Here is Samantha. You can see she's got a very nice little shaped waist, and tummy's flat. And you do have lipedema in your arms too.
I do, yeah, you can see it hang straight down here.
And symptoms too in your arms, right?
Yes.
Okay. So lipedema affects women in their arms about 30% of the time. But you can see the difference between her waist and her legs. And she's lost a lot of shape down here around her knees, which are bulging out, and as well as around the ankles. She's not, she doesn't have the thickness and cuffs as much as some patients with lipedema, but certainly most of her weight is in her legs. So anyways, thank you, and we'll come back. Hey Sam.
Hey.
How you doing?
I'm doing great.
Okay, for our audience, so I just completed the sculpting on the first leg, so I'm going to show you guys before she even gets to see. So here, this one over here is undone. That's the one we just finished. So roll your legs back and forth just a little bit. Yeah, roll them from one side to the other. Slowly, slowly, slowly. Okay, cool. All right, so hey, let's sit you up. What do you think?
Oh my, I can't believe it. I can't believe it, that's insane.
Well, let's take a look here. So you see your kneecap, right?
I haven't, I can imagine shorts, I can already imagine shorts.
Okay, look at it from the back. You can hold on my shoulder here and go up on your tippy toe. Just grab on my shoulder. Oh, look, right there. Look at behind you. So, there's a shapely leg, right?
That's amazing. I'm so glad I came.
You're so glad you came.
I'm already crying, we're not even done.
So we talked a lot about your choice to come here, right?
Yeah, I looked at everything. I looked at everything.
Yeah. So.
Looked at all the doctors before I made this decision.
Okay, well come on back down. Lay down here. Samantha.
Hey.
How you doing?
Really good.
You made it through 4 hours of my boot camp.
Yep, it was a boot camp.
It was a boot camp, yes. Hell, hey, come up here where we finished the second side you haven't seen. So.
I can't get over it. That is.
So
that's a transformation.
Okay, lay down straight. There we go. Look at those shape, look at those knees, the beautiful knees, the calf. Okay, you ready to stand up? Mm-hmm. You feeling okay?
Yeah, feeling great. That is incredible. Look at that. That's a transformation.
Awesome.
Wow.
Okay, you go ahead and look, and then you just turn around and look at it from all different angles, okay?
Wow. Wow, I got some legs.
Okay, you feeling all right?
Yeah, feeling good.
Okay.
Feeling really good.
You like what you see?
Really like what I see,
Okay,
yeah.
so you can say goodbye.
Bye.